Good afternoon, everyone. This is Dr. Bhupesh once again for you all from Dr. BKM OET Institutes. Our contact number is 76967 34256. So today we are going to discuss about the reading part A, and it is very important, the reading part A. So I will start everything. This video will have everything, every information, each piece of thing you need for reading. So I'm just going to cover everything in this video, including why reading part A is important. See guys, again, I will tell you how the marking happens in the reading. So when it comes to the marking of the reading, part A is very, very crucial. Why it is crucial, guys? Because it has 20 marks. And if you will understand that if your this part is good, then obviously you will score 17 to 18. Total marks you need to pass is around 32. I'm not saying 100% 32, because if paper is easy, cutoff can go to 33. If paper is difficult, then cutoff can be 30 as well. That is why it is very important. When your exam is difficult, you have higher chances of passing. Why? When exam is difficult, many people, many candidates do not perform up to their potential. So if by chance a difficult exam comes, that means even person scoring 30 can pass. So if you are students of Dr. BKM, or if you are watching our videos, then please, if the exam is difficult today, you have a golden chance to pass, because even 29 or 30 can be the passing marks. So don't lose heart in the exam. That is the first thing you should understand. Considering reading part A, 20 questions, total marks we need is 32. 32 minus 17, if I would say, so it would be 15. So even if by chance you score 15 in the part B and C, 17 marks should be fetched from part A. So obviously we can understand that part A is more than 50% of our marks. If you get 19 in this part, so obviously then you only have to take 13 in the part B and C. That is why reading part A is very, very important. So first and the most important thing I would like to tell about part A, writing. Writing means writing should be neat. Whatever you are writing, it should be neat and nice. Whether it is listening part A or reading part A, please keep your writing good. Grammar, oh sorry, spelling mistakes are very important. Don't do any spelling mistakes. So no spelling mistakes. And again, I have told you the importance that it is the maximum, it is the major chunk of our OET reading and listening. Even listening has got even 24 questions. So in listening, part A is more important than reading part A. Please try to understand these concepts. Once you are clear in the mind that reading part A, listening part A is very important, you start practicing it. Otherwise, you keep on training yourself for the part B and C, and ultimately you do not prepare well. Second thing, now we will talk about, I have told all the important things. Marks should be maximum, writing should be neat, spelling mistakes should not be there, and now let's come to the technique. Very important thing, because again, no matter how many times I teach people, people follow their own methods, but I am telling you the best techniques of doing reading part A. First of all, read 7 questions, first 7 questions. Some people start from 8th question. This is the worst possible thing you can do by starting from the 8th question. Never start from 8th question, start from first question. Read first 7 questions. I will show you how to do that. First of all, read 7 questions. Try to find 4 to 5 questions in 2 minutes. That is the main thing. Maybe you can find 6 questions. Depending upon the exam or difficulty of the exam, you will find 4 to 6 questions in the reading part A. Reading part A, out of the first 7 questions, 4 to 6 questions in 2 minutes. Once you will do that, that means now you are left up with 13 questions. 20 minus 7, 13 questions. And you have 13 minutes. So now you can well understand you will have all the time in the world. When you waste 4 to 5 minutes in 1 to 7 questions, or when you start from 8th question, that is what creates the trouble. Never start from 8th question and never do all the 7 questions. because one or two questions will be tricky. Now let's implement this technique. Okay. I don't know what kind of a paper is this. You guys told me that I should do this today, and this was your material as well. So I'm just gonna start from here. Okay. In the speaking, in OET speaking, never say gonna like I said gonna. So you just say we should never start from there. Okay. I'm just gonna start from here, and we'll try to do this reading part A. Okay. I'm reading first 7 questions and let's see how much time does it take. First 7 questions. The correct route for the administration of chlorpheniramine. So my keyword is correct route and administration of this chlorpheniramine. Okay. The likely cause of rigors and fever. The best way to describe patient symptoms. So these are also symptoms, but they are talking about the cause of the symptoms. So they are talking about the etiology. This is talking about the treatment. First, try to understand questions that which paragraph can it be. Route of administration, that means treatment. Likely cause, that means etiology. So treatment should be in the last. Normally, treatment should be in the last. Causes should be in the first. A part, B part. So that is how you should be able to understand. Best way to describe patient symptoms, A or B, because symptoms would be told in the initial stages of the topic. Initial steps to take when treating a critically ill patient. So my keywords critically ill patient, again treatment part. Various symptoms of the patients who have had a transfusion reaction. Again, symptoms. They can be third and fifth can be same. Where to document the findings of the appropriate investigation. Investigation should be before the treatment. It can be in the C part. The effect of the various medications for managing patient symptoms. Again, it should be in the C or D part because they are talking about effect of various medication means side effects. Now you just go to the topic. Let's go to the topic. I'm just going to enlarge it for your better vision. Now you're going to text A is talking about investigating acute transfusion reactions. Record the following information, type of transfusion, length of time. You just read the topic from top. Investigating acute transfusion reactions, immediate report, take the samples, send them to laboratory, take the following samples, send to this. Then these are full blood count this, complete a transfusion reaction form, record the so they are talking about the investigation. So I had one question from the investigations, so most probably answer of that question should be investigation. There was a question regarding the investigation, this one. Sixth answer should be answer should be A. So that is how you save your time. I'm not confident about it, but I'm telling you how to do it. So I have got investigation word, so I did that. Second part is talking about relevant effects, drugs and doses. They are talking about oxygen, there's chlorpheniramine. So there is the word chlorpheniramine. So I have to do question number one. Question number one answer should be B. As far as I think. Means you don't overthink. Easy questions should be done in easy way. So they are talking about relevant effects. They are talking about drugs and doses. They are talking about notes. Then C part is talking about kinds of different causes. There is the cause, there is the symptoms. So symptoms, causes, signs, category, mild 1, mild 2. And they are talking about, I guess, what they are talking about? Recognition and management of acute transfusion reactions. So they are talking about acute transfusion reactions. This is the signs, this is the symptom, this is the cause. So causes are given in the part C. And then when you go to D part is talking about immediate reaction, life-threatening situations that maintain airway, stop the transfusion. If there is anything wrong, that means they are talking about the adverse reactions that can happen with the transfusion. So I am teaching you, that's why I took some time. But now let's see, if I would have been alone, it has taken me only 1.5 minutes. Question number one, administration of chlorpheniramine. There, if administration is given, this is given, but administration is not given. Dose is given. Administration is not given. Oh, that's surprising. But otherwise, answer should be B without any thoughts because chlorpheniramine is not given anywhere. Let me check. Let me cross check it. If it is given anywhere else, no, I don't think so. It's given. So I'm wasting my time over here. So question number one, answer should be B as per me. Can you help me with the answers? I'm just going to unmute you. Please don't have the background noises. I want you to participate. Question number one, answer is B.
Yes,
Yes,
sir.
sir.
Yes,
Sir.
Yes, sir.
Likely cause of rigors and fever. Rigors and fevers, rigors and fevers either should be given in this. Otherwise, we were talking about this. So rigors, fever word is there, signs are there, symptoms are there. If I can see the word rigor, that will make my journey. Yeah, rigor fever. So answer is C. All good?
Yes, sir.
Yes, sir.
Okay, I'm getting some background cases, guys. Otherwise, I have to mute you all. Okay, I will mute you all. I can't help it because somebody is making noise. The best way to describe patient symptoms. Now we are talking about symptoms. Symptoms are given in this. Best way, I'm not quite sure. This question is little tricky. Otherwise, I will do C. But best way of symptoms, record the following information on the patient notes. No symptoms are not mentioned. So again, I will go with these symptoms and I will not make this question difficult. So question number 3, I have to do C again. Question number 4, initial steps to take when treating a critically ill patient. I think patient should be critical care. So I think it should be D. Otherwise, obviously management is given in this. Critical can be here as well, life threatening. So that is also critical. So I want the immediate steps. Rigors, anxiety, and this is talking about cause, but they are not talking about management. So obviously part D is talking about management. So the only question I am not sure about until now is third. Fourth question answer should be D only. Can you please help me with the question number 4?
Yes, sir. D.
Okay. So again, because you have, they were asking about treatment. So treatment was given here. Treatment was not given over here. So I didn't do from here. So that is how fast you will be in the exam. Don't leave these questions. Various symptoms of the patient who have had a transfusion reaction. I think transfusion reaction happened over here. So symptoms should be here only. Check a fresh urine sample, but symptoms are not given over here. So this is a tough question. So otherwise symptoms are given over here, or otherwise symptoms are not given over here too. Febrile transfusion reactions. Immediate report all the acute transfusion reactions with the exception of mild hypersensitivity. It can be A as well. But anyhow, again, see, I told you, you would be able to do only 5 questions maximum. So again, this question is difficult. Where to document the findings of appropriate investigations? It should be in the part A, investigations.
Yes.
Yes, sir.
Yes, sir.
The effect of various medications for managing patient symptom. Effect of the medications. Medications are given in these. The effects are given. So the answer is B. So in the final exam also paper would be like this. You will get 5 questions very simply. Now anybody who wastes time on third question, anybody who wastes time on fifth question is gone. That person cannot manage time. Please try to understand this important thing. You will feel like doing it. How can I leave it? But this is the technique. You will be able to do 4 to 6 questions. In all the exam, 2 questions will be tricky. What do you mean by tricky? Tricky means this word, the best way. Extra words are given. Various symptoms of the patients who had a transfusion reaction. This could have been easy, but I was not sure, so I did not do it. But otherwise, rest of the questions were pretty much okay. We could have done from the heading. That is what is the difference between simple and difficult question, that you can find them easy. Now, the most important step, question number 8. Now you will understand the importance of doing 1 to 7 questions. For how long should a patient's urine be collected? So urine word was given somewhere over here when I was reading, or in the part, yeah, checkup for 24 hours. See, that is the benefit of doing skimming and scanning for 7 questions. Now you can find this word here. So it is given for how long should a patient? 24 hours. Is it right?
Yes, sir.
Yes, sir.
Yes,
Yes,
sir.
sir.
What should be used to appropriately transport a blood culture? Blood culture, I did not find anywhere. So obviously we have not done A part too much. So that should be over there only, part A, blood culture. If I can find the blood culture, yeah, blood culture. In an appropriate blood culture bottle. So first of all, try to find where it is given. First of try to find where it is given. Now I will read the question carefully, that what is my question. So now I will read the question, just a second. And in your exam, it would be easy because you will have question paper with you. Computer is difficult. What should be used to appropriately transport? So answer is blood culture bottle.
Yes, sir.
Yes,
Sir.
sir.
Easy again. How long should 0.9% saline be given to the patient if he is hypotensive? So hypotensive means most probably he had a kind of a reaction. So it should be in the D part. I will try to find that in the D part. or otherwise it can be in this part because they were talking about that affects. So hypotensive word, now I will go back. So please understand what I am doing. First, I am trying to find where it is. Then I am reading the question again. How long should 0.9 saline be given? How long? Over 5 minutes. Is it okay?
Yes, sir.
Yes, sir.
Done. That is
Yes,
how
sir.
the paper is going to be. Any question that is difficult, you have to leave it. Not only from the first 7 questions, 8, 9, 10th were easy. That's why I did it. If I don't find it, I leave it. That is the main thing to save time. What type of now, and also we know where it is given. That is the benefit of doing 1 to 7 questions. You know where it is given. What type of admission is warranted for a patient experienced stridor? So stridor word by chance I can see here. So what type of admission is warranted? Require oxygen and critical care admission. This is also good.
Yes, sir.
What,
Yes, sir.
what might a category 3 patient show more than a 20% drop? My main keyword is 20% drop. 20% drop means 20% decrease. And category 3 means categories were given in which paragraph? Here.
Taxi.
And 20% decrease. This is fall of 20%. What is falling?
Systolic BP.
Systolic BP. So that's your answer. Because this is given rise of. So you cannot write heart rate. It is decrease of. Question is decrease. That is where you have to read the questions carefully. What is best avoided if a patient has a low platelet count? Low platelet count should be in this or it should be in the part A. Low platelet count. Low platelet count. I will still see to it if I can find low platelet anywhere here. Because it can be
Part text B, sir.
text B.
Yes, sir.
Yes, sir. Text B, sir.
Point. 1, 2, 3, 4. Okay. No, 4 point is not.
Third point, sir. Third point.
Third
point, sir.
Okay, yeah.
In the notes.
So now
From second line.
if you would not have done this reading, this was still a little tricky question because it is given in the hidden form. But still, we would have found it what is best. But again, if you are unable to find it, just leave it. Now I will read the often what can be avoided. What is best avoided? What is best avoided? Aspirin containing products. Right? This
Yes,
is
sir.
so a vein from the dash. Always read the articles very carefully and prepositions. They have a huge importance. And maximum times 8 to 13 question will be easy one in the final exam. 16 to 20 question will be easy as well. So that is why it is very important to reach to the end. By chance in the end, if you do not find time and you have left third and fifth question, now I know a lot about symptoms. I will do both the questions as C because symptoms were majorly given in the C. At least one will go right. Third and fifth, one answer is C.
The third answer is A.
No, one answer is C.
Fifth is
Yes,
C,
sir.
sir.
Fifth one.
That is what I am saying. You buy it. Please understand. Please listen to my words carefully. Don't go for answers. What I am teaching you is the method. Suppose I am telling you I want to do these questions later because if by chance I do not find time, I know symptoms are given in the C. I will write both the things C. So still I will get 1 mark. But if I do not reach to the end of the reading, I will lose more marks. Are you getting my point?
Yes, sir.
Yes, sir.
Please, again, I'm telling you, listen to this video 5 times, 10 times, 20 times, but please follow this method. It will save your life. Again, you please don't start from 8th question. Oh, sir, I didn't know that we have to start from the first question. I've told million times, yeah, this is the only method of passing reading part A with comfort. A vein from the dash should be used for the sample collection if a reaction occurs following transfusion. So reaction was given in which? In which? Majorly?
Part A.
Part A and
Part A, sir.
part A or D. D was also about reaction, guys. See, reaction.
Yes.
But still, I am saving time because I will see A or D. I will not see B or C. At least this saves my time. So I need the word vein. So D, I will try to find the word vein. Vein word is not there. I can't see it. Then I will go to A. So this is what it does. When you do 1 to 7 question, this keeps you in mind. So I need the word vein. Yeah, here it is vein. Now I will read the question carefully. First of all, I try to find where it is. to save my time. Now skimming and scanning is done. A vein from the dash should be used for the sample collection. A vein from the, my preposition is from the. A vein from the immediate blood transfusion samples from a vein in the opposite arm. The opposite arm article is given. Opposite arm,
Yes.
Yes,
Yes,
sir.
sir.
always read these articles, these prepositions, they are hint. If a patient experience place a pain close to the site of, it is likely to be classified as a reaction. So where was categorization given? A, B, C or D?
C, sir.
C.
C.
C. So classification word means categorization. Category 1, 2, 3. So if a patient experience close to the site of infusion, so I will immediately go to C and will try to find the word site of infusion. Anywhere site of infusion is given? No.
Category 3, sir.
Symptoms, sir. Sir, in symptoms, category 3.
Sorry.
Sir, in category 3,
Okay,
symptoms.
so it is given over here only. So it is given in category 3. Now I will read the question again because I want to write classified a dash reaction. I need a life-threatening reaction. The answer is life-threatening.
Yes, sir.
Category 3.
Sir.
Sorry,
Oh, life.
Life threatening.
but the answer should be life-threatening reaction. It should, or is it given category 3?
No, sir. Life threatening. Sir, both options were right. Both.
That's great. Okay. Otherwise, with a word, I like more of life-threatening reaction. See, if a patient experience close to, it is likely to be classified as a life-threatening reaction. This is going better. So you also have to make a proper sentence. A nebulizer should be used to administer at 5 mg. So where was dose was given? Dose was given in which
B part. That's B.
part? 5 ml nebulizer use under expert guidance 5 by or and what is the question now? What is the question? A nebulizer used to administer dash. Okay, I want to write the medication. Administer salbutamol and amylopine. You can write any of these, right? Okay. Salbutamol is the major word we have found. Again, please try to understand. Don't think our answer is right or wrong. First of all, try to understand the method. Read 1 to 7 questions. If any question is difficult, leave it. First strategy. Leave it. Please leave it. Don't waste time. Time is precious. Then find the keywords. Find the keywords urine collected, blood culture, zero point 0.9 saline. These are the keywords. Strider keyword, 20% drop, 20% keyword, because you can, keyword means in the reading part A that you can find them easily. 20%, it would be given in numerical form, you can find it easily. 0.9 would be given in numerical form. Culture is a very different word, can easily be found. Urine is a very different word. Strider is a very different word. Hypotensive is a very different word. So please try to understand. And on the top of it, you should also understand that saline should be given, patient is hypotensive, this is a reaction, so this should be either in the part C or should be in the part D. So you go according to those things. Are you getting the method, guys?
Yes,
Yes, sir. Yes, sir.
So first 7 questions are not done only just because you want to do them first. It's also to understand that when you, suppose if I read this reaction, emergency word means, emergency means immediate.
Yes.
Immediate means most probably it should be given in the D.
D.
Most probably. That is what you need to understand. So it saves my time. That is what, again, I always tell this calculation to everyone. Suppose even if you save 5 seconds in one question, do you know what is the importance of 5 seconds? 5 seconds into 20. Do you know what it is? 5 seconds into 20 means 100 seconds. And do you know what 100 seconds means?
1.5 minutes.
1 minute 40 seconds. So in the exam, total of 15 minutes, you are saving 1 minute and 40 seconds, guys. It's almost 2 minutes by this method. I would normally say you are saving 10 seconds because you know where it is given. Let's see this one. There is no need to report transfusion if they do not occur. Visual confirmation is sufficient. Urine sample was given in D part only, right? Urine sample. And it was given in the A part as well. It was given in A and D. Headache is a symptom, should be given in the C, and pruritus should be given in the C. So that is where I am saving my time. And if I save 10 seconds, then if I multiply, then it becomes 200 seconds. So do you know how much I am saving? 3 minutes and 20 seconds. This is the method to save your time, guys. And in also, again, learn bleeding, emergency situation. Bleeding, first of all, try to find this word, bleeding and emergency reaction. Okay. Bleeding and emergency reaction. Okay. Bleeding and emergency. Most probably it should be in the D. So I'm going in the D, bleeding and hypertensive. And what was the other word? Bleeding and?
Emergency.
So it is not given over here. Not given over here. Urine word is given over here. So bleeding is not given over here. So I have to change my thing. So
Last second point.
No, sir,
Last
the
second
last
point.
second last line, sir.
all right, yeah, here. Assess for the bleeding from the puncture sites. Now my preposition from is given. Let's see if from is given in the question, it will become easy. An assessment from. My preposition. See, that is what I'm trying and teach you. Everything is well defined in OETR, and that is what you need to understand. It is the easiest exam of the world if you take it nicely, if you take the proper thing. So an assessment from the bleeding from puncture wounds or whatever was given. Fit in. There is no need to report dash if they do indeed occur. Means I don't have to report. I don't have to report. I don't have to report. It should not be over here. It should be in A part.
Only first.
A only. So immediately report all these things with the exception of mild hypersensitivity and non-hemolytic febrile transfusion reactions. So these two things are not important to be. So mild hypersensitivity, or you can write this word, can be the answer. Got it, guys?
Yes, sir.
Yes, sir.
Not even taking 2-3 minutes here. It's just, and I would finish this reading part in 12 to 13 minutes because I am saving my 3 minutes anyhow. Visual confirmation is sufficient to check for dash in recent urine sample. Urine word was given over here. Here it is. Then this recent means fresh. That is what you need to understand. Do not ignore the words like recent, neither in the part B, C, neither in listening nor in reading. So visually signs for hemoglobinuria. I hope this is the one where there is it's sufficient to check for hemoglobinuria.
Yes, sir.
Okay.
Yes, sir.
A patient may be considered dash if they can experience pruritus. Pruritus word was given over here. We were seeing somewhere pruritus. I could see somewhere either here or in the C most probably.
C, sir.
It's C. Pruritus is given. Now I will read the question. So please understand. First, find where it is. If you cannot find, don't read it again. Save your time. Patient may be considered dash if they experience. Patient may be considered. Sorry. Hypersensitive patient may be considered mild. Just again, I have to find some other word. See, that is what is taking time now. I am unable to fit any word. Accompanied by a headache. So that is not given. Headache word I think is not given over here. That is why I'm not finding it. So priorities and headaches. That is why that is why I was having problem. So it was not in there. Moderately severe. You treat fever, this and this, pruritus with headache. Pruritus with headache is given only in this. So obviously it is a moderately severe. So now I will try to fit in the word. A patient is considered to be moderately severe. So the answer of 20th is moderately.
Category 2, sir.
Okay, are you getting my point?
Yes, sir.
So again, we have taken overall 30 minutes for this complete lecture where I have told you each and everything about reading part A. Please listen to this lecture 2-3 times, means give 2 hours. And trust me, reading you will pass anyhow. Because again, I have told you the marking scheme as well in this reading video. Do not underestimate this video. Please listen to this again and again. Each and every word I have spoken is what I have gained over 11 years of experience. What can be the best technique? What should be the best technique? And why it is important? I have told you every logic, every rationality, every relevance to it. Relevance, logic, and rationality is a very important word. Rationale. Rationale means logic. What is the logic? So I've told you the logic, the rationale behind this thing. So please listen to this video 2-3 times for your good, for not for me. Thank you very much, guys.